Welcome to today's edition of Mental Health Matters. Today we're going to be talking about COVID-19 Part 2. Dr. Abshire is on the show. He's going to continue talking about COVID-19 and share his personal experience and what the medical field is doing to combat this virus. So get you something to drink, get you something to eat, and come on back and stay tuned. So welcome back to part 2 of our discussion on coronavirus.
Thank you for having me back, Jesse.
Yeah, you're welcome. That's great. I love talking to your wife because you guys are a wealth of knowledge to me. So I like to learn. I like to talk to people. I'm very social. So this discussion is really, I enjoy it very much. So let's just start. How is this pandemic affecting you and your household? Like, how are you guys handling it?
Overall, I'd say we're doing great.
Okay.
2 or 3 weeks ago, we had a virtual trip to Cancun.
I love it.
We were going to be going to Cancun, and that got shut down. So
Yeah.
we stayed at home and just pretended to be there and had some Mexican food.
Yeah.
So that was all good, and Carol and I get along great.
Awesome.
So at the end of a week of being with each other 24/7,
Yeah.
she was sorry to see me go back to work. So
Yeah.
that was definitely a good side. It's certainly affected my work, which I talked earlier about with how that's going. But Carol's a gerontologist, so she works with seniors, and so she helps people find places to live and living situations and caregivers and that sort of thing. So it's greatly affected her business and what she does. Plus she has a lot of insider view that I hear about in terms of what's going on in the nursing homes and the assisted livings out there. And there's a lot of sad stories to be hearing out there. And so she's really kind of gotten down over that. Plus and her business is kind of dried up with all of this. Because everybody's afraid to go out or be anywhere or have anybody come over and help them. And so again, she's again, we talked earlier about you have to have something positive to do with your life, and so her positive thing to be doing with her life was been really kind of taken away from her in some respects, and so that's been tough on her. But really tougher on her clients, the elderly that are being socially isolated.
Well, she got a good sense of humor, so I know she
She has to have a good sense of humor to stay with me.
So we talked about earlier with your wife too. We talked about, and I'm so glad she brought this up because it never occurred to me to even have this part of discussion about COVID-19. But she talked about non-essential workers.
Right.
So what constitutes that? Who makes that decision? And like you said, all of us, whether you are working at Macy's or Walmart or flipping burgers, whatever it is, we are all part of a puzzle, and each part is important in this thing we call life, society, and our community. And so let's talk a bit about the non-essential. Why do you think that it was classified as that, and how do you think that is actually affecting people mentally, so to speak?
Well, I think that is huge. So the people who are sort of in charge of our society are the
Yeah.
ones that kind of picked out who is and who isn't
Yeah.
an essential worker, and I think some of it makes sense, and some of it I think is sort of arbitrary.
Yeah.
But I think, to me, really, we're all essential. But to those of us that have been deemed in the non-essential category,
Yeah.
that's got to take a huge hit on them psychologically.
Yeah.
Basically, we've taken away their purpose, their sense of being.
Yeah.
Really, if you will.
Yeah, and think about
and
the-
so to suddenly be told you're non-essential.
Yeah.
Boy, that's a put down of tremendous magnitude.
Yeah.
And to try to overcome that is really, I think, really tough. And I'd like to think of all of us as essential. I think it's essential for me to be able to go out and eat at a restaurant, and the entertainment industry,
Yeah.
hotels,
Yeah.
you know, store workers. To me, that's all part of our society, if you will.
Yeah.
And I think it's all essential in their own special way.
Yeah, and think about like local gyms. Think about people exercising, and you know, when you exercise, especially at the gym, you that's a form of socialization. That's a form of getting your physical health, building your immune system up, and things like that. So I feel like, to me, that could be classified as essential.
I would certainly put it in that that category.
Yeah.
And certainly, I think it is essential. I think we still need to be smart about it.
Yeah.
So if you're sick, don't go to the gym, but you know, make sure you're healthy, and you know, and with this coronavirus, certainly wiping down equipment, which I think is frequently done at gyms too. But
Yeah.
but the healthy amongst us to be able to get out and start enjoying those things again.
Yeah, yeah. How do you think people are gonna bounce back from this? Because, you know, I know people are ready to get out. I do a lot of searching the internet, just especially with the state of Georgia, Florida, just looking at different states, and I know they have started to open up, making a transition in Atlanta, and I think they have opened up beaches in Florida or moving towards that, but people are ready to get out. People are ready to get back to life as you know, as we see it, you know, so to speak. And I think a lot of political officials are under pressure. I was reading about Governor Newsom, how he was on a lot of pressure himself to start opening things back up.
I'm sure he is. Yeah.
I know I think it's Yuba and Sutter counties the mall is open back up against Governor Newsom stay-at-home order and stuff like that. So how do we get back to normal, in your opinion, once this thing is over? Or do you think we will ever get back to normal?
Well, a good question is, once this thing is over, a key to it is we need to have herd immunity.
Mm-hmm.
And so, you know, herd immunity is when enough people have been exposed to it and developed their immunity to it. I kind of think of herd immunity. Imagine a map of the city, and so we have streets that run east-west and north-south. And we got this virus particle out there, and it's wanting to travel all over town.
Yeah.
And if you put up one roadblock out there, that would be, for instance, somebody who's had the virus and gotten over it and has immunity to it.
Yeah.
Then that would keep the virus from traveling in that little direction, but there's still plenty of other places to go.
Yeah.
With herd immunity, I think of it as there's enough roadblocks out there to the virus that it has no place to go.
Yeah. Wow.
And to have herd immunity, we need to have at least 50%, maybe 70% at least, numbers of people that are immune, enough roadblocks out there, if you will, that the virus has no place to go. And that's where we eventually need to get to. Unfortunately, we don't have a vaccine to it right now.
Yeah.
So I do think we need to develop immunity, and so one thing that I think a lot of people look at and I've heard, is people look at, they look at the tracking of the number of coronavirus cases that we've had. And unfortunately, that number is always going up, and they look at that number and they get depressed and are fearful. The way I like to think of it, I think the really important number is the number of deaths per day. And to me, in the ideal situation, our number of deaths per day is 0. And the number of people that have been exposed is everybody. So in other words, we have enough roadblocks out there to have herd immunity, and nobody's dying from it. That's where we need to eventually get to. So to me, when I see the number of people that have had coronavirus going up and the number of deaths per day, which I think again is really the most important number, our deaths per day are definitely trending down. So it makes me happy to see those two curves going in opposite directions. So instead of looking at it and developing fear, I'm looking at it and saying, hey, we've got a chance, we're working in the right direction to overcome this thing.
Wow.
And we're all working at it together, and I think we need to keep that in mind, because I think there's a lot of back and forth and people getting angry with each other, but we need to be thinking about all of us having enough roadblocks out there that the virus can't get anywhere. So basically the healthy of us need to be able to develop the herd immunity.
That's a good way to look at it.
And it does mean taking some risk out there, but that's the way we need to fight this war, if you will.
People are saying that there will be a second wave of this corona once things are back to normal, or once they find a vaccine. People are saying that it's going to be even worse, especially in the winter season that's coming up, because we know flu normally is in winter time, in the cold, if I'm saying this right. But people are definitely saying that it's going to, what do you think about that? Do you think that's true?
I think some of that, people look back at the Spanish flu pandemic of 1918, 1919, there was a second wave, and so I think that's where that thought process comes from. What I think we need to do is again, hopefully have enough herd immunity in place so that when next winter rolls around, it doesn't hit us so hard. Whether a vaccine can be ready at that point, I don't know. So hopefully enough of us can develop immunity between now and then. Is what I think we need to do. Try to keep from exposing the high-risk people. The really high-risk people, to me, are really the highest risk group is the elderly nursing home patients with multiple medical problems. So when you look at the median age of people dying from the COVID virus, the median age is around age 80. The average life expectancy in the U.S. Is also around age 80. And so when you look at things that way, I think it kind of gives you a little different perspective. What we need to do is not expose those at the highest risk, but still letting them live. And I feel sorry for, I know of people in nursing homes, assisted livings that maybe a little forgetful, cognitive impairment problems, and having trouble understanding it, and being socially isolated, and just being sad and crying all day. And I hate to see those people not being around their loved ones. And I think what we need to do is let them be around their healthy loved ones. So we need to still make sure that we're minimizing any exposure to virus as best we can, but I think we need to let people start to open up a little bit, and doing some activities, and not being socially isolated to quite such a great degree.
Yeah, yeah. So one of the things that I was noticing during this time is the hospitals or physicians like yourself, it seems like people who had or has underlying conditions, it seems like a lot of that is not being, it's not saying that it's not as important, but it seems like the coronavirus pandemic has taken over where people who may have a bad case of asthma or may need surgery for something else, it seems like that it's still important, but it's kind of like, okay, don't come call unless this going on. So what do you think about that? Like, what do you?
All of life is really a balancing act.
Yeah.
There's always risks to be had.
Yeah.
Again, if we totally, the extreme is we all hibernate in a cave and never be around anybody else, we never get the virus.
Yeah.
And that's one extreme.
Yeah.
Again, for the reasons I mentioned further, I think that's not the way to go. But so we need to try to find a happy medium where people aren't being totally socially isolated. They can still get enjoyment out of their life, but they need to be. We need to be smart about it. So if you're sick, certainly stay away from the people at high risk. There's actually, a tremendous number of people that are at high risk. So we've got the people at the very highest risk is the nursing home patients that have multiple medical problems. But people with diabetes, that's 20% of the population right there. We've got people with heart disease, blood pressure, anybody over 65. Patients with cancer or immune suppressed from some other reason, we're starting to look at just a huge percent of the population have some degree of decreased immunity.
Yeah. I don't wear a mask all the time. I don't have a whole lot of them, and I don't feel the need to, and I think I'm just fine. So washing hands. They said wear mask, wash your hands. And I walked in, I do hand sanitize and wash your hands. I do that. That's just thing I feel is needed for me. Wipes and stuff like that. Why is washing your hands is like really important to help a person during this time?
We can get the respiratory droplets can get out on surfaces, so people cough or sneeze or whatever. And the respiratory droplets get out on these surfaces, and the virus can survive for some time on the surface, and then we touch the surface with our hand, and then we touch it with touch it to our face somewhere. People tend to have the habit of touching their face a lot. And so if you can wash your hands frequently, so that when you do happen to touch your face, there's nothing on it, so that it keeps you from getting it. I
wash my hands a lot. I find that to be, I think that's definitely, I mean, we're supposed to do that anyway before the coronavirus ever came about. We was always told, wash your hands, wash your hands, wash your hands, I think people are getting more accustomed to doing that, who was not washing their hands. Now, people wear gloves. It said that you can cross-contaminate when you wear gloves. Is there any truth to that?
Well, Jesse, if I have a glove on, and let's say there's a virus particle on this surface, and I touch it with the glove on, and then I touch my face, really not much difference whether I have the glove on or not. I've still kind of done the damage. I suppose if I cough on my hand, and then I put a glove on it, and then I go to touch somebody else or something else, it keeps me from getting whatever I coughed on my hand on that other surface. But if I touch another surface that has the virus on it and then touch my hand or my face somewhere, then I'm potentially spreading it. So gloves have their place and purpose, but they aren't the total panacea, if you will.
I was talking to a friend about this last night, and she was very adamant about I mean, she going through gloves, and
Right.
she would go to the grocery store, of course, and she touched the bug, and she just all about it. And I was kind of talking to her about this. I said, well, you can kind of
Right.
mess yourself up, because you touching carts and doing all this, and you grab your food items, and
Right.
then you scratch your hair and all this stuff. But in her mind, she didn't
Right.
look at it that way. She's just
Yeah.
like, oh my God, I'm just wearing gloves
Yeah.
and stuff.
Well, I know some people are arguing out there that maybe we should never shake hands or give hugs again.
Yeah.
To me, again, that's leading to social isolation,
Yeah.
which I mentioned again,
Yeah.
is on the order of magnitude of picking up smoking.
Yeah. Wow.
And so I think social isolation is bad. So I look forward to the day that it's acceptable again to shake hands and hug.
Yeah, yeah.
And at least up until a couple of months ago, I would shake hands with patients, and
Yeah.
then I'd wash my hands and
Yeah.
go to the next patient.
Yeah.
And as long as I kept my hands washed,
Yeah.
I managed to stay healthy.
Yeah, it's kind of weird though. It's a little bit awkward though that we and now we understand the reason why we don't do it now for some of us, but it is a little bit awkward that we don't, shake hands or hugs and things like that. That's been a common practice for a lot of us.
That's part of the human experience.
Yes, exactly.
And I think every time we shake hands, there's a little bit of a bond.
Yeah, exactly.
That's made between people.
Yeah.
And again, that's connecting with somebody is just a huge part of life.
Yes, exactly.
And so to cut off our connections with other people, to me again, is unhealthy.
Yeah, I definitely agree.
Yeah.
I know, let's talk a little bit about the businesses that's not being affected, because a lot of people have businesses that are actually closed, and this is affecting their livelihood. A lot of people are having to reach out to food banks. A lot of people didn't have a savings or, and things like that, but that they can fall back on. And do you think that we are ready to get back to normal in terms of letting business transition to open back up and stuff like that? And
I certainly hope so.
Yeah.
The whole point of the shutdown was to flatten the curve, if you will.
yeah,
And the whole point of flattening the curve is so we don't overwhelm the medical system.
yeah,
And we did see the medical system being on the brink of being overwhelmed in some of those big cities.
yeah,
And fortunately, we've been successful at flattening the curve, if you will.
yeah.
So the key now is to try and open things up without causing us to totally spike up again. So it is a balancing act, but I look forward to the day that we can be open again. I feel sorry for somebody who spent their whole life working for their business, and they were right on the borderline of staying afloat, and then you suddenly have no income at all, and everything they've been working for is gone.
Yeah.
So,
Yeah, that's unfortunate, very unfortunate. What do you think people can do when they start back opening things up and people are able to start going back to the malls and just business that's been affected by this? What do you think they can do to just to get back in their lane? Because I know it's going to be tough for a lot of people to get their business back, up and going like that. What can they do to try to survive if there's even another wave coming? Because if there's another wave coming, we potentially may be back in the same situation. What can?
Yeah. Again, I think hand washing is key.
Yeah.
I've seen some of these plexiglass barriers at grocery stores, and maybe I understand they're starting to do some of that, and for instance, at restaurant booths and things. So if somebody coughs, it doesn't spread all around. So I think just as a society as a whole, we need to be conscious. So if you've got a fever, stay home, stay isolated, make sure you're safe before you go out again.
Yeah.
And again, I think hand washing is key.
Yeah.
But hopefully these businesses can open up and start to function normally again. I think a key is going to be seeing the fear
Yeah.
go away.
Yeah.
And so hopefully when people see, states like Georgia opening up and they've been open, I think, for about 3 weeks or so now.
Yeah.
Slowly, and they haven't peaked or spiked. They've continued to trend down.
Yeah. Yeah. I know.
And so to me, that's very encouraging, and hopefully,
Yeah.
hopefully we really, as a society, need to be able to overcome the fear.
Yeah, I know when we do open, when they start to, cause I think here we got like what, three or four phases. I think that they're gonna still require people to wear masks and still do social distancing and things like that. And but I don't think people gonna really honor that to a certain extent. I think obviously if you go in a place of business, if they requiring that, then you will do it. But outside that, I think people are just ready to get back to have some type of normalcy, if that makes sense. People are ready to get back to being social and,
Right.
just like, So let me ask you now, so have you ever lived through, I mean, in your life, have you ever been through a similar situation, a pandemic that you can recall?
Well,
or know anybody that
there have been several times over the years. Every several years, there's a bad flu.
Yeah.
So every year, the flu virus kills 10 to 50, 60,000 people. I think the Hong Kong flu in 1969 killed about 100,000 in the U.S. And I was in school at the time. We kept going to school. I remember stories of it being bad, but we just kept functioning as a society. And certainly there have been years of swine flu and different flus. So every 5-6 years we've got a bad flu season coming around where tens of thousands, 50, 60,000 people die from it. And fortunately, I think we don't shut down society for those occasions. My fear going forward is every time there's a bad virus going around, that we want to shut everything down again. And I hope that doesn't happen again. I think other medical problems overwhelm the effects of the virus. So cardiovascular problems, stroke, heart attack, diabetes. So any kind of stressor makes diabetes worse. It makes heart disease worse, increases risk for stroke and cancer, and weakens your immune system. And shutting down society is a huge stressor of a magnitude that we certainly haven't seen before in our lifetime.
This is obviously my first time being in a situation to be quarantined, so to speak. And I don't know, I sometimes I'm driving, I kind of think to myself, like, wow, this is really happening here. This is life. Not a lot of traffic is on, you don't see a lot of cars out, just going to work in the morning, and I pay attention to stuff like that.
I again encourage people to really try and look for the positive. So we look at this situation and it's bad, but again, I encourage people to seek gratitude. And also look at perspective. So one thing that I try to emphasize for people to do, three thoughts that I like to keep in mind, and it keeps me going in tough times, is I think of attitude, focus, and perspective.
Nice.
And I actually wear a little bracelet that says attitude, focus, and perspective on it. And so attitude, keeping a positive attitude. Focus is focusing on your faith, and I think people of faith out there can use their faith to strengthen themselves in these times. And anybody with a faith where they believe in an eternal afterlife, of whatever faith that might be, can use that. And then the other part of that is perspective. And two parts of perspective that I think people tend not to think about is the past and the future. So when we talk about the future, for those of us who believe in an eternal afterlife, from a future perspective or an eternal perspective, whatever problem we're going through now here on earth is trivial compared to an eternal perspective in the afterlife.
Yeah.
And so when you think of things that way, it kind of lessens the magnitude of the problem.
Yeah.
The other way I think of looking at perspective is the past. So if we look at our ancestors and we think back to, let's say, the bubonic plague in Europe, where half the population was wiped out, we can look at that and say, hey, at least we're not through we're not in the bubonic plague, and we can be grateful for that. At least we're not like our ancestors that only lived to be age 30. And so when we think of how they were living, we can be grateful that we live in modern times and we didn't have to go through what they go through. We can be grateful that as bad as the coronavirus is, and it is bad, but we do have treatments for it.
Yeah.
So our ancestors didn't have modern medicine, they didn't have oxygen that they can give people, they didn't have ventilators, they didn't have remdesivir, the new antiviral medicine that they're seeing has promise. There have been, certainly some reports of hydroxychloroquine helping people. So, and I know that's controversial, but we do have reports where that's helped people. And we are also having reports of people that get plasma transfusions of people who've had the virus and then gotten transfused from plasma from people who've already had the virus, and it's we're seeing it saving lives.
Yeah, wow.
And so we've got that. Our ancestors didn't have that. So we try to look and pick out the positive things and being grateful for that.
Yes.
And that helps us to do better.
Okay, well, thank you, Dr. Abshire. We've run out of time, and I really did enjoy having a discussion with you. And your wife, I was off camera too, because she's very knowledgeable too. But thank you guys so much for just coming out and on a Saturday.
Yeah,
I know you
thanks so much for having me here today. Yeah.
So thank you so much.
My pleasure.
I appreciate it.
Yeah, thank you.
Thank you for watching part 2 of the COVID-19 show with Dr. Abshire. If you would like a DVD copy of this show, or if you would like to be a guest on our show, or if you would like to learn more about mental health matters, please dial 916-366-4600. Thank you.